I thought because there are some changes now, I'd just like to make some additional kind of forward views about what's going to happen, and then Patrick is going to add a few as well. The first is just to say something about the Omicron wave. The Omicron wave is still high. And if you look around the UK, we're still in places, we're still between 1 in 20 and 1 in 25 people have got Omicron if they were tested, according to ONS data, which is slightly backward looking. Now, the rates are coming down, but this is still a very common infection. And it is important to view the next period when we will still have testing all the way up to April, and which changes are happening, in fact, in steps. People think about this as one big step. This is a gradual, steady change over a period of time as the rates are going down and as we head into spring. And I think it's important to understand that context. This is not a sudden, everything stops. This is a steady move. Just as the good news is things are going down as we head into spring, we do have to accept that the respiratory season next winter and in subsequent winters is likely to combine COVID, whatever variants are circulating there, flu and all the other respiratory problems. So we expect the winters to be tricky even in the absence of significant new variants. And we, again, the vaccination programme that JCVI will consider will take that into account. And the implications of this are, as we look at the next weeks, we still have high rates of Omicron, and I would urge people in terms of public health advice, and this is very much the government's position, that people should still, if they have COVID, try to prevent other people getting it, and that means self-isolating. So that is the public health advice. It would have been the public health advice and will be the public health advice for multiple other diseases. If you had norovirus, we would give exactly the same public health advice. So this is standard public health advice for a significant and highly transmissible infection. We must have three things. We must have good surveillance, as the Prime Minister said, to ensure that when new variants start to take off or when we start to see new surges, we know where they are and we can respond in a targeted and rapid way to make sure we deal with them before they cause significant problems for individuals and for the NHS. We must have the capacity rapidly to step up in terms of what we're doing, and we must be able to protect the most vulnerable. And those really are the critical things that we need to maintain even beyond this next few weeks into the rest of this year and the rest of the way that we continue to manage this epidemic. Patrick was going to expand a bit on the issues in particular around variation.
Yeah, thank you. So, very clear, this pandemic is not over, and it's carrying on around the world, and we're not out of it here yet. The virus is continuing to evolve. So, every variant is an evolution, and the virus has got a lot of room to evolve. And it will continue to do so quite fast, probably for the next couple of years. Those changes will alter the properties of the virus. There is no guarantee that the next variant is as reduced severity as Omicron. It could be the same, it could be more, it could be less. So as it evolves, what it's trying to do is transmit more readily, to grow. So that could be because it has got intrinsic transmissibility advantage, or it escapes immunity. And the change in severity is a random byproduct. So we expect there to be further variants, and they could be more severe. As Chris has said, if you look at Omicron, actually, with the immunity we've got in the population, the level of severe illness and death has been dramatically reduced. And that's the reason across the world, people are beginning to release measures. It's not just here, everyone is beginning to release measures. But in order to do that safely, there are some things that need to be in place. The first is, it's absolutely essential to have a way of detecting it, a good surveillance system. And we're lucky that we have a very good surveillance system in this country, the ONS study, which is a way of picking up across the population, both at a national level and at a regional level and in different age groups, what is happening, and that detection system is going to be vital. The second thing that's important is being able to respond quickly. So the resilience and the ability to ramp up is absolutely crucial. And that doesn't mean ramp up over months. If something goes wrong, you need to be able to ramp up very quickly. Just remember how quickly Omicron took off. That tells you you've got a couple of weeks to get things back in action. So once you take things off, it's going to be important to know how quickly you can put them back on again and to get them back in shape in time to be able to deal with it.